The key challenges are to have continued leadership, good team working and good communication. These are three essential ingredients for a team, because maternity services is delivered as a teamwork with obstetricians, midwives, anaesthetists and midwifery support workers. So these three ingredients will come into place. Obviously the other challenges are adequacy of staffing and also the facilities which they have to provide safe maternity services. There are a number of ways of overcoming. Leadership is something which people can be trained to acquire to some degree. Obviously, the person who is being trained should have the desire and devotion to become a leader and to help. And King's Fund, this particular program, the Safer Births, has been helping by giving consultants to go out to different units and teaching them about leadership, and also they had a number of lectures on that particular issue. In addition, the team working was promoted by having the mentor sites working very closely with the sites which were enrolled to get the help from King's Fund. Initially I was giving evidence for the Safer Births inquiry held by King's Fund by Honora O'Neill, and subsequently I was asked as the president of the Royal College at that time to get involved as a partner with King's Fund to provide facilities and advice to promote good practice. It is essentially to improve safety. We know that the inquiry by the Healthcare Commission, now it's called the Care Quality Commission, indicated that 89%, nearly 90% of women were satisfied or more than satisfied with the care they get. But despite that, many of the confidential inquiries, such as the confidential inquiry into maternal deaths or perinatal deaths, tend to indicate 50 to 60% there is substandard care, and therefore there's a lapse in safety. And the whole issue facing us is to improve so that we can minimize the avoidable type of mortality and morbidity related to childbirth. So the King's Fund originally, when they started this inquiry, there were regional seminars where the Chief Executive of the King's Fund, along with the members of the King's Fund, along with the partner organizations like the Royal College of Midwives and Obstetricians, we went around to find out what was the issue facing each of the hospitals and to put in place this particular program. So this particular program has a number of elements in addition to leadership, team working, communication. One is collecting statistics, like using what we call as a maternity dashboard, where the clinical incidents are scored and risk incidents are identified, so that the hospital board at a very high level will get involved in working with the maternity team to resolve the problem. So I would think it has benefited, and such a program would be useful for them to continue.